Hello, you're watching The Wire. Today is the 4th of April and this is the daily COVID-19 updates bulletin. As of Saturday morning, the total number of people in India who have been infected by the coronavirus has reached 2,902. This includes 183 people who have been cured or discharged and 68 people who have died so far. In the last 24 hours, 601 new COVID-19 infections and 6 deaths have been reported. Out of the total number of people tested positive, 1,023 people have links to the Nizamuddin coronavirus hotspot in Delhi. Maharashtra has now over 500 people who have tested positive, followed by Tamil Nadu. For detailed statewide data, you can go to The Wire's COVID-19 India tracker, the link of which is given in the description below. Globally, over 58,000 people have died of the virus. The number of people tested positive has reached 11 lakh. The US still remains the most affected country after China, Italy, and Spain. The New York State reported its highest number of deaths in a single day, with one person dying almost every 2.5 minutes. The central government will disburse 11,092 crore rupees to state governments under the State Disaster Risk Management Fund. This came after Prime Minister Modi met state chief ministers via video conference on April 2. According to a statement released by the Ministry of Home Affairs, Maharashtra will be allocated 1,611 crore rupees, whereas Kerala, which has reported close to 300 cases, will be given lesser amount than most states like Chhattisgarh, which has reported only 9 confirmed cases so far. At present, Rajasthan and New Delhi are not in the ministry's list of fund allocations. A coronavirus positive mother gave birth to a healthy baby at the All India Institute of Medical Sciences in New Delhi. According to doctors, this is the first baby to be born to a coronavirus infected mother in India. The baby is currently with the mother and is being fed. So far, there is no proof that suggests that the virus can be transmitted through breastfeeding. Although the mother has tested positive for COVID-19, she is asymptomatic at present. According to WHO, women with COVID-19 can breastfeed if they wish to, but should practice hygiene. In Rajasthan's Bhilwara, which emerged as a coronavirus hotspot, no fresh cases have emerged since the 30th of March. State officials told media that 17 people have recovered from the virus. Bhilwara topped the charts after 26 people tested positive for coronavirus and 1 person died in the district last week. The local administration said that they will continue to take precautionary measures and extend the curfew imposed in the district till the 13th of April. The Punjab government may extend the curfew in the state even after the nationwide lockdown. The reason for this is that Punjab is approaching the harvest season. Harvesting of wheat in the state will begin from the 15th of April onwards. The government has given relaxation from the curfew to farmers, procurement agencies, labourers, and other paraphernalia associated with the process. This will require all those in the process to be out and about, which may lead to an increase in the number of cases if the curfew is lifted around the same time too. The state has 53 people infected with the virus so far, and 5 people have died. A preliminary study has found a correlation between countries that require citizens to get BCG vaccine and those showing fewer numbers of confirmed cases and deaths from COVID-19. According to an assistant professor at the New York Institute of Technology and the lead author of the study, countries including Japan and South Korea, which have managed to control the disease, have universal BCG vaccine policies, whereas countries showing large number of COVID-19 cases like the US and Italy, BCG is a recommended vaccine, but only for people who might be at the risk of TB or meningitis. Germany, Spain, France, and the UK used to have BCG vaccine policies but ended them decades ago. China, where the pandemic began, has a BCG vaccine policy, but it wasn't adhered to very well. Through only this correlation, clinicians in at least 6 countries are running trials that involve giving frontline health workers and elderly people the BCG vaccine to see whether it can indeed provide some level of protection against the new coronavirus. Some senior Indian doctors and researchers, however, shared their skepticism about this correlation with the wire. Dr. Swaroop N., a public health specialist who manages large-scale primary healthcare initiatives at the Karnataka Health Promotion Trust, said that countries selected for research are arbitrary. He added that Australia and Germany have a much lower morbidity and mortality from COVID-19 but have no universal BCG immunization program. Hence, BCG solely cannot be the answer. Dr. Kingshung Poddar, a molecular biologist and serial health technology innovator, emphasized the need for a large-scale epidemiological study on the correlation between COVID-19 and BCG before drawing any conclusions. To read more about this story, you can log on to science.thewire.in. That's all for today. We will be back with another updates episode tomorrow. Until then, stay safe.